All right. Joe Fireforce there in California. Joe, thanks so much, buddy. Let's bring in the doctor on duty for this Friday. Dr. Jennifer Pena is a former White House physician in the Obama administration. She was also Vice President Mike Pence's personal physician for a while. First, let's just start with what we just heard there, Dr. Pena. I mean, in Wisconsin, you've got folks who are packing into bars. Like they're packing in and throwing them back. Bars, restaurants, now some fast food restaurants reopening for dine-in. If someone is going to take that chance, what are some steps that you would recommend to try and minimize the risk for them and for the folks who are serving them?
Yes, good morning, Craig, and thank you for inviting me back. Chaos, confusion, lack of leadership and guidance. That's what I hear with all these stories. Here's the three things that I would urge our state governments as well as our businesses to focus on, right? So are the numbers declining? Number one, do we have the healthcare capacity? And do we have the testing and contact tracing, which we've talked about a lot? In terms of the numbers declining, the most recent models are indicating that we're going to see a spike through August, potentially, almost even double the amount of deaths that we've seen thus far. And that's insane amount of people that might lose their lives. So we have to remember, are we willing to accept the risk, the trade-off of human life to potentially prematurely open business? So I would urge folks to keep that in mind as they're making those decisions. In terms of the healthcare capacity, I don't just mean equipment, ventilators, infrastructure, hospital beds. I also mean the adequacy of the PPE. As you probably heard, Dr. Bright's testimony to Congress this week, a lot of the PPE, N95 masks specifically, that were procured overseas are only offering 30% effectiveness to protect healthcare workers and patients. And so I got to tell you, Craig, I'm about to go into shift this evening, and that does not give me the warm and fuzzies going in terms of protecting myself, my family, and ultimately other patients in the hospital. And so we have to keep that in mind as businesses are using personal protective equipment. How good is that, and how capable are we in terms of healthcare to take care of patients that might potentially get ill? And finally, the contact tracing, right? Very important as a public health exercise. If we see spikes as we reopen business, how are we going to contain those? And so I urge our governments to follow the example of states like Virginia, for example. The Department of Health just hired 1,300 folks just to focus on that contact tracing. And that's the kind of initiative that we have to take across the states as we open up.
Dr. Pena, on this program, we've talked a bit about this frightening illness that's showing up in children and linked to COVID-19. The CDC now alerting doctors to be on the lookout for it, report it to local health officials. What more can you tell us about that?
Yeah, so very scary, right? Because we had thought that children were safer than adults. We always knew they could be asymptomatic carriers, but now we're seeing a lot more children manifest disease. This pediatric multi-system organ inflammatory syndrome, essentially, or Kawasaki-like illness, affects the vessels, the arteries. It can cause an inflammation of these arteries throughout the body, and it can affect the heart and cause very severe illness. And as we know, death in a handful of kids out of New York and also in Europe. And so, symptoms are kind of nonspecific, but parents have to be very vigilant. So things like fever, abdominal pain, rash, pink tongue, redness of the eyes, things of that nature. If your child manifests any of those symptoms, in an overabundance of caution, I would urge parents to contact their pediatricians and healthcare providers immediately. As we now know, children might have been exposed in the past and manifest these conditions or this condition and these symptoms after the fact.
Dr. Pena, before I let you go, and apologies in advance for putting you on the spot, but again, at one point you were personal physician to the vice president. We've seen him on a number of occasions walking around without a mask on in public, despite the guidelines in a number of places. What do you make of that? If he were still your patient, would you call him and say, "Hey, dude, put on the mask"?
Yes, absolutely. And he's heard things like that from me before in other instances and regarding other medical issues. And, I know he's getting appropriate guidance. I have all the faith in the world in the White House medical unit and my colleagues that he's getting the appropriate recommendations and guidance. But ultimately, the decision is personal. Leadership comes from the top. That's my motto. And you have to lead by example. If the federal government is putting out guidance that this is the measures that we have to take for citizens to protect ourselves and protect this country, then again, leadership needs to come from the top, and we have